first, but with a caveat. Describe your culture.
Okay.
So, Mark, do you want to go first?
Sure. Hello, everybody. It's wonderful to be here in balmy Chicago. Cambia Health Solutions is a nonprofit taxable parent company of about 23 companies. The company is 100 years old, or 101 this year, and we have within, I guess, the distinction, interestingly, that in 1917, when our company was founded in Tacoma, Washington, it was the first health insurance company in the world. It was our founders that created it, and they were timber workers who were working in a very dangerous industry. Think about this. This was the year before the great influenza epidemic. And there were no real OSHA standards in the mills and up in the logging operations. It was dangerous, and a lot of people got injured. And generally that would render their families destitute. And so it was the workers themselves that came up with the idea of, well, what if we pool a portion of our weekly wages to be there for Joe and his family? And that was the beginning of health insurance as we know it. So we're very proud of that tradition. I would say that the world has changed a lot since then. But we feel very strongly that we're very in touch with that background. And when I became CEO almost 16 years ago, I was convicted to the notion that the healthcare system was broken, that it was the economic model that was broken. And I told our board when I was interviewing that, if they wanted somebody who was just going to kind of run a health insurance company, which at that point was across 4 states, Blue Cross Blue Shield branded, not-for-profit plans, I was probably not the guy. But if they wanted to take a chance on pivoting the company to the future and take all the lessons we had learned over some, at that point, 85 years, and build something new that would last maybe another 100 years, then maybe I was. And they chose me, I guess. So we've been on that road ever since. So we have really been pivoting beyond the traditional health plan world, and that's why we've grown. We have employees across 30 states and working in various ways to change the consumer experience. So now I'll finish just talking about culture. I would say when I started as the CEO, our culture was pretty traditional. Our prior CEO was very traditional. And I would call it more of a private bureaucracy. Everyone kind of knew their place, they knew what they liked doing, and they were good at doing it, and it served the company reasonably well, very stable. But it was a risk-averse company, and the view around risk was the way to deal with risk is to avoid it. Today, with a lot of hard work and a lot of trial and error, I would say we are now a company that embraces risk. And we are learning how to embrace it and then mitigate it. We've worked very hard on creating a team culture across silos. And I would say our results on that one are probably like 2 steps forward, 1 step back, because changing that culture is challenging in any organization.
Thank you for doing that. Ron, tell us a little bit about Mission Health and describe your culture to us.
Sure. So Mission Health is the safety net health system for the western part of North Carolina. We serve about 1 million people in 18 counties, demographically older, poorer, sick, or less likely to be insured than state and national averages. Our culture has transformed quite a bit. When I got there, the former CEO had just been sort of run out of town, tarred and feathered, related to the doctors rising up and saying, we're not going to do this managed care stuff, and we're not going to be employed, and all that kind of stuff. So it was a pretty angry culture when I got there. I'll never forget, in my first week, one of the physicians, I was trying to meet with all the angry physicians, of which there was a long line.
Welcome.
I reached out my hand to shake his hand. He wouldn't shake the hand. He came into my office. He just almost sat down, and then he slammed his hand on the table, and he said, as a man of Christ, I must tell you, I work 24 hours a day for the destruction of this health system and for your own personal destruction. It's the only thing I think about. It's like, welcome to Asheville.
Yeah.
What I actually said was, that doesn't sound very Christ-like, but that was just, different face, it's all variable. So today, we have shifted to a very population health-centric approach. I'd say there are two core themes that run through the culture. One is quality-focused, continually improving, and then risk-taking, not unlike yours. One of my favorite phrases in my teaching within our leadership program is, if you're not failing, you're not actually trying anything, because nobody's good enough to be successful all the time. And we are, in closing, we're in the midst of going through a very large transaction, being acquired by HCA Healthcare. And the driver of that really was because, we've done terrific. We're not in any distress. We're AA rated. We finished this year with a 10.5% cash flow margin, 3.8% operating margin. So there's no duress.
Yeah.
But our board was absolutely committed to transforming the health of the region, which was our mission. And the earlier discussion from today around social determinants was the driving factor. So we will create the largest per capita foundation that exists in America, solely dedicated to social determinants and transforming the health status of the region.
That's great. Well, so I'll let you start giving that story of why are we talking about resiliency? And how did it fit into how it got you to your second day of employment is basically, right? But seriously, I mean, we are focused on resiliency. How did that fit in as you began to turn the anger off and change people and create the new culture?
Yeah, so I think when you're in my grandfather used to always say, if it ain't broke, don't fix it. But one of Colin Powell's stock phrases is that if it ain't broke, don't fix it, is the slogan of the lazy, the complacent, or the arrogant, because it presupposes that the world that we have today is going to continue on in a tidy, linear fashion. And the reality is we're in a world of constant transformation and change, and that can either be invigorating for somebody like me, or it can be debilitating for many people that just want the world to be constant and safe and secure. So what I saw was for us to take the risk that we needed to transform our organization in a way that could move it from a hospital-centric approach to an ambulatory and population-based approach, to sort of get rid of that anger and focus on what can we be and how can we be it. That resiliency was really the only thing that could help manage through that transition. The macro trends at the federal and the state level are all against what we're trying to do. And so we've got to persevere. And I've sort of iterated to a three-legged stool around resilience. Leg one is the environment. The question is, have we made the environment the most effective and efficient and supportive that we can for our teams? And so we've created a program called Renew that sends people out on the front lines, whether it's an OR or a floor or a clinic, and just looks for hassles and joys, both. Hassles that get in the way and joys that give people meaning and purpose. So leg one is making the environment as effective as it can be. Leg two is a team-based culture. And we've tried many things for many years that didn't work, and have adopted a program based upon research that Marcus Buckingham did when he was the lead researcher at Gallup on employee engagement, and have had a big impact with that. And then the third leg of the stool, which is the leg that most people focus almost exclusively on, is personal resilience, embedding science-based, because I can't do anything else, practices, which I was really skeptical of originally until I read the literature, around meditation and gratitude and giving. And so those three forces sort of drive our engagement.
Excellent. And what were some of the early results or accomplishments when you think about what needles did you move first?
Yeah, so I'll go to the engagement, and then I'll give you one clinical example. On the engagement side, I had been there like 3.5, 4 years. And we'd lowered our mortality rate by 40%. We're named for the third time in a row one of the top 15 health systems in America. And, but if you looked at our employee engagement on the traditional survey-based method, it was flat. It was like flat as Kansas. And you know, two things came to mind was that's not normal human behavior if it doesn't move at all. And so being the good CEO, I said, what was it like before I got here? Because I don't want to be responsible for all of this. And so I looked back 5 years prior, and it was literally flat. No matter whether the CEO was getting thrown out, whether they were making money, losing money, made no difference. Flat, 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 flat. So I told our leader of organizational transformation, who's responsible for HR, he said, I don't invest in things where the needle doesn't move. And we're either going to quit and sort of ignore all this employee engagement stuff, or we're going to do something different. And so we engaged in the process that I just described of the three-legged stool in this tool called Standout from the Marcus Buckingham Company. And in 1 year, we went from, not surprisingly, when we started, being below the national average. The national average is like 18.6% of fully engaged employees. We were 17.9. And in 1 year, we went to 39%.
Fantastic.
So it was a
Great.
complete transformation, and not just a transformation that you could measure, but that you could touch and feel.
Those are great examples, and congratulations on the success. I don't hear a lot of people tracking joy, so I think that's
No,
fantastic.
it's a loss.
That is
People
great.
think that joy is
Yeah.
the inverse
Yeah.
of burnout, and it's not.
Yeah, yeah. Well, thank you for sharing those. Those are great. So, Mark, tell us about what drives success for cultures, and what have your experiences and results been?
Well, I would say, you know, culture is hard to change,
It is.
and one has to be pretty humble when one decides they're going to take it on. And like my mom used to say, my favorite saying of hers was, you know, if you want to make real change, it's gentle pressure, relentlessly applied over time. And that's how she parented us.
How gentle
It
was
wasn't always so gentle.
That's good, though.
But that is very true with culture. And so I believe it has to start at the top, and you have to be authentic about it, and you have to be absolutely consistent about what the cultural norms are that you're trying to achieve, and it has to start with your values.